Hi, everybody. My name is Deleruyelle, and I am a nurse, and I work in the Living Donor Office at Michigan Medicine. And I'm going to be going over some facts and myths of living kidney donation. Some other team members in the Living Donor Office are Chad, Kelly, Deb, Rachel, and Angela. So, although the decision to become a living donor involves careful consideration, being a living donor offers recipients an alternative to waiting on the National Transplant waiting list for an organ from a deceased donor. So today I'm going to talk about living kidney donation program at Michigan Medicine. I'm going to go over some facts and myths of living donation. I'm going to talk a little bit about the National Living Donor Assistance Center, and I'm going to talk about the living kidney donor process at Michigan Medicine. So the number of Michigan residents waiting for a kidney transplant as of December 2020 was over 2,000 people. That number goes up to over 99,000 people nationwide. Since 1964, U of M has completed over 7,000 kidney transplants. Michigan's largest pediatric transplant center is Michigan Medicine. And there's organ matching software was developed at Michigan Medicine to pair kidney donors with hard to match recipients. This slide shows the number of kidney transplants completed at Michigan Medicine from the years 2016 to 2020. So the first set of bar graphs are the total number of transplants completed, and then the remaining bar graphs are the type of transplant. So they were either from a deceased kidney donor, a living related kidney donor, or a living unrelated donor. So in 2020, we completed 192 kidney transplants. 136 of those came from deceased kidney donors. 18 of them came from a living related donor, and 38 came from a living unrelated kidney donor. So this just shows the number of transplants completed and where the transplants, what type of donors the transplants came from. So now I'm going to start with some facts and myths of living donation. And our first myth here is that living kidney donors won't live a healthy life with just one kidney. So the fact is that you can live a healthy, normal life with just one functioning kidney. That kidney that remains can take care of the job that both kidneys did. Another myth is living kidney donors don't choose which person that they want to donate their kidney to. Well, the fact is donors do choose if they're compatible, and this is called direct donation. If a donor and a recipient are not compatible, Michigan Medicine does offer the option of paired donation. And I believe paired donation was discussed in the previous presentation. Another myth, living kidney donors live a shorter life. The fact is the overall lifespan is slightly better for living donors than it is in healthy people in the same demographic area. And this is because living donors must be very healthy to donate. A myth here is living kidney donation harms a donor's sex life. Well, the fact is living donors can have a healthy sex life once recovered and feel better and ready. This usually happens a couple weeks after donation. Here's a myth, living kidney donors can't have children. Well, the fact is living donors can and do have children. Pregnancy does put an extra strain on the remaining kidney. However, that kidney usually works well without a problem. So Michigan Medicine does recommend that women wait at least 6 months to become pregnant after their donation procedure. Potential donors should consult with their OB doctor and also discuss a plan with the transplant doctor before donation. So if pregnancy does pertain to the potential donor, this topic is discussed during the evaluation process. Here's a myth. Some religions may oppose organ donation. Well, the fact is, organ donation is supported by all religions, and it is viewed as an act of charity and goodwill. A myth. Living kidney donors are more likely to get kidney disease after donating. Well, the fact is that they are not. One kidney does not increase one's chance of kidney failure. However, there is a slight chance donation can increase blood pressure. If the high blood pressure is not controlled or treated, it can cause kidney disease. So this is one critical reason why yearly checkups after donation are advised. A myth. Living kidney donors have to take anti-rejection medications or medication for life. Well, the fact is donors do not have to take anti-rejection medication. The transplant recipients do. A kidney donor will be given prescription for pain medication and stool softeners at discharge from the hospital for the recovery period only. A myth. Only younger people should be able to get a kidney transplant. Well, the fact is all patients with end-stage kidney disease who are eligible for a transplant deserve a transplant. Here's a myth. Only adults over the age of 25 and under the age of 65 can donate. Well, the fact is that a donor age 18 and older can donate. A living donor older than 65 can also donate and have no problems from the surgery. The kidney from a donor, from an older donor, older than 65, can work very well. People who donate are in good health without diabetes, cancer, heart disease, or kidney disease. A myth. People with high-risk behaviors can't be living kidney donors. The fact is, high-risk behaviors are not an automatic rule-out. All potential donors are screened for behavior risks that may lead to transmittable infections. And a myth here is people with tattoos can't donate a kidney. Well, the fact is people can donate a kidney with tattoos. The ink has no effect on the kidney. Routine screening ensures that the tattoo has not caused an infection. Potential donors should not get a tattoo because there is a chance of transmitting an infection, and these are donors who are in the evaluation process and moving towards surgery. We would want to wait until you are cleared from the donation surgery procedure if you want to then get a tattoo. And here's a myth. A kidney donor will have debilitating pain for an extended period of time. Well, the fact is donors will have some pain after surgery from the incisions and related from the gas and bloating. This pain will diminish in the days following surgery and can be controlled with pain medication. Here's a myth. A kidney donor will be on bed rest following surgery and will be in the hospital for an extended period of time. The fact is donors are out of bed and walking the day of surgery and independently before discharge. At Michigan Medicine, they typically are discharged home the day following surgery. And here's a myth. Living donors will no longer be able to participate in sports or exercise. Well, the fact is a kidney donor should be able to return to most regular activities at 6 to 8 weeks and exercise or strenuous activities at 8 weeks. At Michigan Medicine, there's also a lifting restriction of 10 pounds maximum for 6 to 8 weeks post-surgery. And this restriction will help decrease any post-op complications. Here's a myth. A kidney donor will have to follow a new diet plan and can no longer consume alcohol following donation. Well, the fact is that there are not any dietary restrictions following donation. everyone should eat a healthy, well-balanced diet. Excessive alcohol use is always dangerous, and everyone should consume alcohol in moderation. And here's a myth. A donor is responsible for the cost of being a donor, or the recipient's insurance is. Well, the fact is, at Michigan Medicine, all costs of evaluation, surgery, complications are paid for by Michigan Medicine. In fact, all complications related to the donation procedure are covered for a donor's lifetime. Here's a myth. I would like to donate one of my kidneys, but I won't be able to do that unless one of my family members is in need. Well, the fact is, while that used to be the case, it isn't any longer. You can help a distant family member, friend, or a complete stranger by donating a kidney. All living donors undergo an extensive questioning to ensure they are aware of the risks, that their decision to donate isn't based on financial gain. Okay, so now we're going to talk a little bit about donor financial assistance. And the National Living Donor Assistance Center is a federal agency that provides assistance with expenses related to donation that are not covered by Michigan Medicine. So this organization can pay for the travel and lodging for the evaluation, the surgery, the initial post-op visit for the donor, and for one support person. Eligibility for these funds are based on the recipient's household income and some other guidelines. And this organization was established to provide greater access to transplantation to people who want to donate but can't afford these above expenses. So if you're interested in learning more about the National Living Donor Assistance Center, you can contact the Living Donor Office, and we can help give you some more details and also assist in the application process. So the process to become a living kidney donor, only potential kidney donors can contact the Living Kidney Donor Office to begin the process. So you can, donors can call our 1-800 number that's listed here on the screen. They can send us an email at the txp-donors@med.umich.edu. They can also visit the Michigan Medicine Transplant website, and there is an online form that you can just put in your name and your phone number and email address, and then that form will come to the Living Donor Office, and then we can contact you to start the process. So that, again, that online form is found on our website. There's also a QR code here on the screen for that form as well. So steps to living kidney donation. So we just talked about the first step is to contact us. The second step then will be to complete an intake to determine if a donor can proceed with a workup. This intake is like a screening, and it gives us some information as to how to proceed with either testing or a formal evaluation at U of M. The formal evaluation, it consists of being evaluated by physicians, a kidney doctor, a surgeon, a social worker, nurse, and a dietitian. And then once the evaluation is completed and all of the testing is completed and accepted, then we move on to being cleared for the donation procedure, cleared for surgery. We are able to work with people who live outside the state of Michigan. Depending on which state the donor lives in, we can partner with their local transplant center to assist in the evaluation process. Or sometimes the donor does have to travel to Michigan Medicine to complete the evaluation process. So it kind of depends on where the donor lives and how we proceed with the evaluation. So this is something that can definitely be discussed more with one of the coordinators in the donor office. We also have a group of volunteers called peer mentors, who are people who completed the living kidney donation process at Michigan Medicine, and they are available to discuss all aspects of their kidney donation experience. So they are willing to share their story and their experience as a kidney donor that completed the process at Michigan Medicine, and they offer a great perspective for our potential donors. So donor safety at Michigan Medicine is our #1 concern. To be approved as a donor, the committee must believe that the donor will not be negatively impacted. And we look at the donor from all aspects. We evaluate them physically, socially, emotionally, and financially. So the multidisciplinary team that completes the evaluation really wants to ensure that all donors are going to be safe after donation. So, some final facts of living kidney donation. First of all, there is no substantial greater risks of health problems if a healthy lifestyle is led after donation. Not being compatible with your recipient does not mean you can't help them. Paired donation does allow for a transplant to occur. And living donation ensures that a transplant can occur, and it opens up a place for someone else on that waiting list. In addition, living donor transplants are better than deceased. The length of time that the transplanted kidney will last is typically longer with a living donor. The operation is planned, and the wait time to transplant is shorter. But it's important to remember that transplant, either living or deceased, does provide improved quality of life compared to dialysis for most patients. So this concludes my portion of the facts and myths of living donation. If you have any questions on the information that was provided today, please let us know. Thank you again very much.